Everybody, it's Dr. T. Just checking in, seeing how everybody's doing. And I was asked an interesting question. I'm going to sit down so the phone doesn't move around. I was asked an interesting question earlier, and the question was, why is it that doctors don't listen? Like, why do we gaslight? Why do we tell you everything's fine? Why do we tell you that, hey, don't worry about it, everything looks normal? Why is it that doctors gaslight and tell you things when we know that it's making you feel like we're not listening? Sorry, I'm fixing my hair. I think there's a bit of a deep reason, there's a superficial reason. The superficial reason why you can't get the care that you want as a perimenopause or menopausal woman. Why is it so difficult to get your questions answered? Why can't you get them to order the labs you want? Why can't you get them to talk to you about the pros and cons of hormone replacement therapy when you're in that perimenopause or menopausal group? I will tell you, most OBGYNs that are still delivering babies, the price point on a woman that is pregnant, give or take, depending on the part of the country you're in, contracts, things like that, it's about $3,000 per baby you deliver. A menopausal woman, perimenopausal woman, if you're taking insurance, 100, 120 bucks. So therefore, they're going to spend, it's just human nature. We're going to spend more time with the patients that are going to have the higher value monetarily, because if they see 51, 52 patients in a day, which happens all the time, they're going to see patients that are going to be quicker, first of all, and those are the return OBs. Return OB, that's uncomplicated, 5-minute appointment, 10-minute appointment. You coming in with a list of symptoms, you've already seen other doctors, things aren't going well, you've got a list of questions. The doctors are going to kind of be like, they got to get in, they got to get out. So it's human nature for them to kind of gaslight you a bit. Oh, studies show this. Doesn't mean that you have any. You look normal. Everything looks great. Well, you look great. Oh, you're too young to have that. Oh, I don't order labs because, well, can't tell anything with labs anyways because your hormones are always fluctuating. So the reality is, when you hear stuff like that, basically what that means is that they don't want to do it. They don't have the time and they don't want to. It doesn't mean that they don't know how per se, but that's the other thing. If they order a bunch of labs on you, then they have to follow up. They've got to know what to do and they've got to want to do it. So when a doctor gaslights, in a way, that's a nice way of telling you they just don't want to do it. They don't want to deal with it. And that's why I always say, it's not, I have patients ask all the time, how do I get my doctor to do this? My answer always is you don't. You're not going to get them to do it, because if they don't want to do it, they're not going to do it. I mean, they're human beings, and if it's not their forte, they're not going to do it, and you're the one that ends up suffering. The good news is that there are doctors out there that, like myself, that may have stopped doing OB years ago, and we have time. So instead of seeing 50 patients a day, I might see 15. And you have more time then to spend with people. Now, don't get me wrong, I'm not perfect. I've had people say, I wish I would have spent more time with them, but I never cut somebody off that has more questions. So if you come and you've got a lot of questions, I'm going to answer them. I mean, I'm going to do my best to answer them. We still have some time constraints, but it's not the same. So when you see a doctor that's got 3 women upstairs that are in labor, he or she has 50 patients in the office that day, and you come in with your insomnia and your hot flashes and your mood swings, so easy to just put you on a birth control pill, right? And say, hey, see you later, come back in 2 weeks. Or they'll just pawn you off on their nurse practitioner or physician assistant because they don't have the time. So here's the thing. Go in, concise, have your questions ready to go. Realize that you're probably going to get 10 minutes. Ask your questions. If you don't feel like you're getting the attention that you want, then go somewhere else. Find somebody that you can spend the time with, that you feel heard with. And like I said, even with me, and I specialize in hormones, I was looking today, I've got like 646 Google reviews and a 4.9 rating, and I'm really thankful for that. I'm so thankful that people take the time to leave good ones. But also there's a couple bad ones on there because I just can't make everybody happy. I would love to. I think we all have that in our human nature. We want to make people happy. We want to please people, but sometimes I can't do it, no matter what I do. And it's usually a personality thing. People just are frustrated by the system, and no matter what I do, I can't make them happy. Sometimes I maybe I didn't give her what she needed or what she wanted, but the majority of the reviews are positive, and that's what I'm telling you is look at those reviews like you would a restaurant. There's going to be some bad ones. I had a lady leave me a 1 star because she didn't like my curtains. It's constructive feedback. I'll take that, and I'll maybe change my curtains. When I first went out on my own, I actually was renting space from a med spa, and I had a lady come in that wasn't happy about the fact that it was in a med spa. So, it's like I can't change all that stuff, but keep that in mind. Now, if a doctor has an overwhelming amount of bad reviews, then I might look elsewhere. But you want to just go with somebody that you're comfortable with. So here's the thing. You want the time that you deserve, and you deserve the time that you deserve. But go in, have your questions ready, have your symptoms ready, ask them what they would do, ask them what you would like for them to do. And if they won't do it, I think it's worth asking why. I think it's a good question, but you're not going to make them do it. As far as blood work, there are mixed opinions from other HRT docs. Okay, that's fine. But again, I think it's lazy. Why wouldn't they order labs? Ask them. That's the answer you get. The number one answer would be no answer. Number two would be, oh, I don't check hormones because they fluctuate all the time. That's garbage. And number two would be, well, I just go based on symptoms. Okay, well, that's not really going to tell you a lot. And here's the thing. I could go based on symptoms too, but I kind of want to know. I want to know. I want to have more data. I think more data is better. More data gives you more points, more things to look at, and it can help you decide if the therapy that you're using is working. It can sometimes high and low of a certain hormone can have the same symptoms. So you really just want to keep I think it's no skin off of my back to order a lab. I mean, it takes literally 3 seconds to click the button to order the labs. It's more of a problem for you. So I don't know when they say, oh, the insurance won't pay for it and blah, blah, blah. It really makes absolutely no sense to me because it's all about you. It's about what you want, not what I want. So the fact that there's doctors out there saying that, and I know exactly who they are because they are influencers and they've written books, but I'm telling you, it makes absolutely no sense not to order hormones to me. I can't afford to go to one doctor after another, copay after copay until I find, yeah, I mean, I get that. But that's why you can do research. You can ask your friends. You can go to compounding pharmacies in your area and ask them who they would recommend because they're the ones that are getting the prescriptions from the hormone physicians that are actually out there prescribing stuff. So there's definitely ways to advocate for yourself and to do the research ahead of time. Most of those doctors, I'll be perfectly honest, like myself, probably don't take insurance. And it's not because it's a get rich quick scheme. It's just that I could not personally run my office and pay my bills if I took insurance. I physically couldn't do it because I'm by myself. If I was in a big group with like 10 other doctors and I was sharing expenses, it might be a little bit easier. But then you have the waiting rooms full and people are, it's kind of not a great way to do things. So I get the frustration. Maybe make a call to a local compounding pharmacy, see who they would recommend, and go see that person. And that is exactly why I made an appointment with you. My OB gave me no reason for no blood work. And I thank you. I really appreciate you coming in and seeing me. Doesn't mean they're bad. It doesn't mean they're a bad doctor. Like I'm telling you, it's just when you fall into the party line like that as a physician, the reason that those same things get brought up over and over again, oh, I don't do blood work. It's because they're being fed that by the system. They're being told they don't need to order lab work by the North American Menopause Society, by the American College of OBGYN. And there's nothing inherently wrong with those organizations. but they tend to indoctrinate the way that they want it to be run. And who do you think pays for that? The North American Menopause Society, I did a whole episode on this on my podcast. They are basically funded by big pharmacy. There's a couple of big supplement companies that have bought in and some insurance companies. So you really have to take that with a grain of salt. Because if the insurance companies are trying to influence anything, do you think they want you to get your blood checked? Hell no. Blood can cost $1,000. And they don't want you to do blood tests, so they don't have to pay anything for it. So I think keep in mind, the doctor doesn't pay a dime for you to get your blood drawn. That's all on you, right? So why would they not do it? If you tell me I want to have my blood drawn, I click a button, order the blood. It takes about 2 to 5 seconds to do it. I'm confused about the traditional pharmacy and what they dispense and company. A traditional pharmacy is like Walgreens, CVS, and some of those actually do compound now. But compounding pharmacy can also be a regular pharmacy, like the pharmacy I use in Austin is called Tarrytown. They do compounding, but they also fill regular prescription. But what compounding means is they make it. They buy the raw ingredients, they'll buy estradiol, testosterone, progesterone, and they make it based on my prescription to fit your prescription. So I could put a cream, I could do a sublingual tablet, I can do a suppository, I could do a capsule. So let's say I wanted to do progesterone. I can pick a dose of 50 milligrams. If I sent you to CVS or Walgreens, there's 2 doses. There's 100 and there's 200, and they're both oral. There's no creams or anything like that. You're getting confused with the terminology of synthetic and bioidentical. So there's a lot of bioidentical hormones that are now available through CVS and Walgreens, progesterone, estrogen patches, estradiol capsules. Those are all available through regular pharmacies. Compounded means they're making it based on how I tell them to make it, and that's the difference. The hormones are basically the same. This may seem like a very stupid question, but I thought I heard you say, doctor, that you can use estradiol on other areas besides the vagina. Yeah, I don't ever actually prescribe vaginal estradiol. Maybe every once in a while. I use topical estradiol cream. You put it on your abdomen, your inner thighs. I use sublingual tablets. I rarely will do a vaginal dose because the vaginal estrogen is usually just for vaginal symptoms. And if it's a doctor that's just prescribing vaginal estrogen, it's probably because they're afraid of using systemic estrogen because they're still listening to the Women's Health Initiative. What should I say to my doc who wants to take away my progesterone after my hysterectomy? Tell him you don't want to. Tell him you like it. Hey, I really like it. I like sleeping. I like how it calms me down. I don't want to go off the progesterone. Okay, then, and if they still want to take you off of it, find another doctor. I usually like to leave these around 10 minutes. It takes a few minutes to just get it up and going, but we've got a good amount of followers. I appreciate y'all coming in on a Saturday evening. I'm heading off. I'm in Boston still. There's a game going on over at Fenway, but I got a group of people I'm meeting with tonight, and I will see you all on the flip side. I keep commenting. I'll try to answer those as much as I can. Thank you very much, and you all have a good Saturday.